And when was your last head-to-toe exam?
About a year and a half ago, so I'm due for one.
Okay, definitely. When was your last eye exam?
More than 2 years ago.
Okay. Okay. Do you have any complaints today?
I've had some headaches recently. They come and go, especially at night.
Okay, all right. And so how long has this been going on?
On and off for about 2 months.
Okay. Any change in diet or lifestyle that you're aware of?
I stopped eating dairy recently to see if that improves my sleep.
Sure.
Because I also have trouble falling asleep at night. I'm not sure if they're related or not, but that's a major change.
Okay.
Other than that, nothing else that should be contributing to this now.
Any other dietary restrictions that you have?
No, I'm not allergic to anything, just stopping dairy.
No known allergies?
No.
And have you been taking anything to help you sleep or to stop the headaches?
I'm taking magnesium.
Okay.
As well as melatonin, but not every night because I have intense dreams from the melatonin.
Okay. Are you interested in medication to sleep, or are you wanting to go more the natural route?
What would you recommend?
For natural remedies, I would say valerian root. Definitely look into valerian and chamomile tea. Chamomile in any form can be really good for sleep. Also peppermint. I know that sometimes those things can not be as strong as we'd like. So if you are hesitant to try prescription medication, we can start you on that. And then if things don't get better, then we can look into other options.
Okay.
Okay.
I'll give those a try before medication.
Absolutely, yes. And do you have any other concerns aside from the headache and lack of sleep?
I've also had a sharp abdominal pain that comes and goes.
Okay.
I'm not sure if it's related to the headache, but it definitely makes it harder to fall asleep at night.
Absolutely. So it comes and goes, and so you think it's completely random?
Maybe because of the dairy. Maybe
Okay. All right, that could be
coming off
possibility.
of dairy could be a side effect.
Absolutely. Is it a sharp pain?
Yeah.
Okay.
Right here.
All right, and is it anything with the skin or external, or do you think it's all internal?
I've not noticed anything on the skin, but I've also not really paid attention. So
Okay.
maybe you could check that out too.
Sure. Any nausea?
A little bit in the morning.
Okay, in the morning. Any chance that you are pregnant?
No.
Okay. I'm just going to ask a few questions about your family history.
Okay.
Do you have any history of hypertension or blood disorders?
No, I don't think so.
Okay. Lung disorders?
No.
Okay. Diabetes?
No.
No. Okay. Liver problems?
No.
Okay.
My family is pretty healthy,
Okay.
I'd say.
All right. Then is there anything else I should be aware of that would run in your family? Skin problems?
No, I don't think so. My mom also suffers sometimes from trouble falling asleep, so that's the only thing that I'd say runs in the family that I've noticed. But other than that, they're pretty healthy.
It's a very common issue to have, but it can be debilitating if you don't find ways to treat it effectively. So hopefully we can get you on the right track. So for now, I want you to get on the bed, and I'll start by taking a look at your vitals. Okay? All right. So I'm going to listen to your heart and your lungs and your blood pressure. Okay. Okay. So first I want you to go ahead and breathe normally for me. Okay, good. Only S1 and S2 are present, no S3. Heart rate sounds normal. Going to listen on the bell side. Okay. No murmurs. Great. And listen to your lungs now. If you could take a deep breath in for me. And out. Okay, deep breath in. And out. And then 2 more deep breaths. Okay, good. Alright, and relax. Your lungs sound perfectly healthy. Are you a smoker?
No,
Any history of smoking?
my parents, yes.
Okay.
Smoked.
Okay.
Not anymore though.
Okay, that's a good thing. Really good. All sounds are clear. So, do you have an arm preference?
Whichever I am.
I'll go ahead and use this one. Okay. Alright, make sure your legs are uncrossed. Okay. That's 122/80, so perfectly normal. Okay. Go ahead and slide that off. Whoops. Okay, can I have your index finger? I'll go ahead and see your oxygenation. Okay, hold that there. All right. And this looks excellent. Your heart rate is 82 beats per minute. Oxygenation is 98% at room air. So your vitals are all looking really good. I'm going to go ahead and just move on to do a quick cranial nerve assessment, okay? Okay. Just going to look at the texture of your skin. It's very normally perfused. No excess amelia. I'm seeing very little sun damage, so very good. Skin is not excessively oily or dry. It just seems to be very healthy. So that's good. You do have a little bit of freckling, but nothing aside from that. Okay. I'm just going to check the nerves of your face. If you could puff up your cheeks for me. I'm going to try to close them. Good. Now keep them normal. Try to puff them up for me. Okay, very good. Now I'm going to apply some pressure to the bridge of your nose. Try to turn your head to your left.
Okay.
Okay, good. And the other way. Very good. I'm just going to be testing the strength of your cervical spine, so try to look up at the ceiling for me. Alright, now touch your chin to your chest. Very good. Raise your eyebrows. Okay, frown for me. Smile, show me all your teeth. Okay, and frown. Okay, everything looks really good there. So keep your eyes closed, and you're going to feel a cool sensation. Let me know which side of your face you feel it on, the left or the right.
Left. Right. 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 Center.
Good.
Left. Left. Center again. Left. Right.
Very good. Okay. So I'm going to give you two sensations. 1 and 2. Do you feel the difference?
Yes.
Okay, so this is going to be a soft sensation, and this will be sharp. Go ahead and say soft or sharp.
Soft. Sharp. Sharp. Soft. Soft. Sharp. Soft. 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 Sharp.
Very good. Okay. So, you don't seem to have any neurological issues in the face. I'm going to test your smell and your taste now. So keep your eyes closed, and I'm going to give you a few options to taste. Go ahead and let me know. This is the testing paper, so open, close, open. What did that taste like to you?
Slightly bitter.
Bitter taste. Okay. Okay, test paper 2. Open, close, open. What did that taste like to you?
That's sweet.
Yes, very good. Just a couple more. Okay, open, close, open. Okay. What does that taste like to you?
Sour.
Okay. And one more. 3.
It tastes like chocolate.
Okay.
Very sweet.
All right. So you got most of them right. The one you said was bitter was supposed to be just a testing paper. And the chocolate one was actually strawberries, but it was still sweet. I'm not too concerned, but we're going to definitely keep tabs on that next time you come in. Let's take a look at your smell. Okay. What does it smell like to you? Inhale.
Cinnamon.
Yes. Perfect.
Cinnamon, yeah.
Mm-hmm. All right. This one, inhale.
That one is coffee.
Coffee. Very good. Okay. Smell.
I think that's pine wood.
Oh, what?
Pine wood.
Pine wind?
Pine wood.
Oh, pine wood. Okay. Yes. It was pine wood. Yes. Very good. And one more.
That's lemon balm.
Yes. Excellent. Okay. All right, I'm going to do some reflex tapping now. Just to make sure that there's no swelling that I missed. Okay. Your lymph nodes are non-palpable. Your preauriculars and your post, so that's good. Not too concerned there. Do you wear contacts or glasses?
I wear contacts.
Okay. When's the last time you had an eye exam?
Two years ago, I think.
Okay. How do you like your prescription?
I'm pretty happy too.
Okay. Let's go ahead and check and make sure it's all good. Okay, go ahead and look straight ahead for me. Okay, very healthy optic nerves. No excess veinage, no jaundice. Your pupils are constricting appropriately to light. Very good. Go ahead and look to your left, look to your right, up and down. Good. Okay, same here. Okay, I'm not seeing any issues, no excess tears, no dryness of the eyes, and your pupils are constricting naturally. Go ahead and look up, look down, to your left, and to your right. Very good. Okay, so let me know when my fingers enter your field of vision, okay? See now.
Now.
Good. Now let me know which fingers are moving, the fingers on your left or your right.
Right.
Good.
Left. Both. Both. Left. Right. Both.
Good. Okay. And go ahead and hold this Snellen chart at arm's length for me. And could you read this third row?
FBH.
Good. And the second to last row?
CFDHJ.
Okay. And this row opposite, so starting with the H.
HBFDL.
Good. And what color is this?
Green.
What color is this?
Red.
Very good. And which circle is larger on the chart? Number 7 or number 4?
Number 7.
Number 3 or number 2?
Number 3.
Number 9 or number 6?
Number 9.
Okay, very good. I'm pretty happy with your vision and your eyes look beautiful, so I'm going to move on and just look in your ears now. Okay. Do you have any hearing issues?
Sometimes I do hear a loud sound at night.
Okay.
Kind of wakes me up, but I don't know if it's because I'm dreaming or because my ears are actually making that sound.
Yeah.
But I do kind of wake up scared from that.
Does it sound internal, or is there someone in the house?
It sounds internal.
Okay. All right. That is very interesting. I'm going to look into that for sure.
Okay, thank you.
Okay. Go ahead and look straight ahead. Okay. Your ears are completely wax-free, which is good. I'm able to visualize the tympanic membrane. It's a little bit wider than what I'd like to see. We like to see a pearl gray, and this is kind of a beige to me, which could indicate some damage to the tympanic membrane. I don't see any signs of infection, so there's no inflammation present, just a little bit different in color. I'm going to check the other side. Okay. This one looks to be completely healthy. It's a pearl gray. Same thing here, same amount of wax, very little. No scarring or scratching, no signs of infection. Okay. I have some eardrops I'm going to send you home with that I think is going to help that left ear. And we'll see if that improves it for now. Don't let me forget that before you leave. I'm going to do some hearing tests though. So if you could close your eyes. Let me know which ear you hear the rustling in, your left or your right.
Right.
Okay. Okay.
Left, left, right. Both of them.
Okay. And let me know when this sound stops. You're going to hear kind of a buzzing sound. Say now when it stops.
Now. 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 Now.
You're going to hear a rustling sensation again. Let me know if you hear it once, twice, or 3 times.
2, 1, 3.
Good. And which sounds further away? Option A or option B? This is B.
B is further.
Good. This is A. This is B.
A is further.
Very good. Okay. So I'm pretty happy with what we've done with your cranial nerve assessment, except for your ear, which I'm going to take note of for sure. All right, so I'm going to have you go ahead and put on a gown just so I can assess the rest of your body, okay? You're going to be laying down face up. Okay. Okay. And before we move on to your abdomen, I'm just going to take a look at your hair to make sure it's healthy. So just relax. You can close your eyes. I'm just going to be making a part and taking a look at how the scalp looks. Okay. Right. Seeing no issues here. Do you ever have any itching of the scalp
A little bit at night.
at nighttime?
Yeah.
Seems like that's when a lot of your issues occur. Which could mean that you might be having some issues with your circadian rhythm. Sometimes the body has a hard time adjusting to a sleep cycle. Seeing a tiny bit of redness. Can I just do a quick test? Okay. So this is a wet or a dry test. Let me know if you feel a wet sensation or a dry sensation.
Wet.
Okay.
Dry. Wet. 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 Dry.
Okay.
Dry. Wet. 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 Dry. Dry. Wet.
Okay. So just judging from the part and what I see on the hairline, I'm seeing some mild irritation, and it probably is something that persists throughout the day, but once you lay down to sleep, you notice it more because you don't have as many distractions. I'm going to spray conditioning treatment on the hair, and you'll let me know by the end of the exam if it's starting to feel better, okay?
Okay.
And I'm going to apply just a little bit of cleanser just to prevent infection. Okay. Just going to be dabbing it a little bit along the part. And we'll take a look at that later and see if it improves. Okay. Any burning sensation?
No, it feels quite
pretty good. Very glad to hear that. Okay. I'm going to make note of that in your chart, but for now, let's move on to your abdominal exam. All right. And do you mind if I unbutton just the first few buttons of your gown?
No,
so I
go
can
ahead.
just get a better look to visualize the abdomen. Okay, very good. Mind if I lower these just a little bit? Excellent. All right, so first I'm going to be listening for any abnormal sounds. Just breathe normally for me. Some normal gurgling, nothing too out of the range of sounds we usually like to hear. And I forgot if you mentioned if you're a coffee drinker.
Yeah, I am a coffee drinker.
Okay, how many cups a day?
Maximum 2.
2? All right. Coffee can be very healthy for things like liver regulation and also general inflammation, so 2 cups does not bother me at all. As long as it's been working for you, that's what's important. Okay. All right. I'm going to be palpating your abdomen now. You're going to feel a light pressure, just feeling things like your liver, your spleen, that your organs are normal in size. Nothing is hardened or enlarged. Let me know if you feel any sharp pains. Everything feels normal. I feel your lymph nodes. Non-palpable, very healthy. Very cutesy, very demure. All right. Okay. Any pain when I did that?
Maybe a little bit on the left side.
Okay.
Very dull though.
Okay. Is that the part where you've been having the sensation? Okay. I'm gonna give you a warm or a cold sensation. So this will be cold. This will be warm. This will be cold. Okay. Say warm or cold.
Cold.
Okay.
Warm. Cold. Cold. Warm. Warm. Cold. 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 Warm. Warm.
Okay, very good. I'm seeing a little bit of inflammation on this side, so I'm going to apply some cream. I think that might help some of the pain that you've been having. We're just going to go ahead and see if the topical approach is good. So it's going to feel cold. I'm going to apply it very gently and then we'll see. Okay. No burning sensation there?
No.
It's all pretty normal.
Feels very good actually.
Good. It's kind of like a massage as well. So hopefully this helps the blood flow to oxygenate better and maybe aid in some of the digestion issues. Okay. Okay, we'll let that sit there. And I'm just going to be feeling your legs for swelling, pain here.
No.
Okay, and I'm squeezing on your knees. Do you feel that pressure equally on both sides?
Yes.
Good. What about here?
Yep.
Good. And here?
Yes, equal.
Okay. And here?
Same sensation.
Okay, good. All right. I'm just going to take a look at your feet real quick. Okay. Go ahead and try to push against my pressure here. Good. Now try to bring your toes up towards yourself. Go against my push. Good. Try to bring your feet in towards each other. Good. And spread your legs if you can. Very good. Okay. So I'm going to be squeezing either your right foot or your left foot. Let me know which one you feel sensation on.
Right. Left. Right. Left. Both.
Okay. Now am I squeezing the heels of your feet or the pads?
Heel. Heel again. Pad. Right pad. Left pad. Both of them.
Very good. Going to take a look at your Babinski response. You don't have to do anything. I'll be applying a pressure and it should elicit a response. Very good. Excellent. Okay. So now I'm going to have you sit up so I can take a look at your back and then we'll be finished, okay?
Okay.
Okay. So I'm going to go ahead and unbutton your gown with your permission. Just put it to the side. Okay, here we go. All right, so your back looks pretty healthy to me. Just going to be looking here for any lumps or protrusions. Okay, I'm not feeling anything abnormal. Okay, you do have a knot here on this right side. Definitely a muscle mass, which just means you've been holding a lot of tension, I see, and issues with tension in the back can translate to other parts of the body, so that could even explain some of the stomach pain you've been having. The internal structure of your organs are all connected, and when one thing is off, it definitely can cause strain in other areas. Just going to do some percussions here. definitely a lot of strain. I'm going to be gently applying some pressure to that area just to help circulate the muscles and kind of de-escalate some of that tension. Let me know if it gets to be too much. Okay, I'm going to do a couple sensory tests. Let me know if you feel this brushing sensation on the left side of your back or the right.
Left, right, right, left, left, right, right, middle, up, middle, middle, right, 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 left, middle, left, right.
Good. You're going to feel a puff of air. Let me know if you feel it once, twice, or 3 times on your back, okay?
Twice, one, 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 one.
Good. Just to complete some of this therapy here, I'm going to apply some more of that anti-inflammatory ointment to the back, okay? Just going to feel very cool, kind of like herbal and kind of warm and cold at the same time, okay? Should feel very good.
Okay.
Okay. And gently pulling the skin around the area to help with that circulation. This should not feel painful. It should just feel like a pressure release. It should not feel like a pinch. Okay. Okay, go ahead, and I'm going to have you put your shirt back on and we can talk about the results, okay? Okay, Luna, so you're in really great shape. I really hope that the valerian root and chamomile tea can help you. Also, meditation. I know these are all things that you've probably heard a million times, but if you commit to them for a couple weeks, let me know if anything has changed. And if not, we can go ahead down the medication route. It is really important to get a good night's sleep, and there's no shame in using aid if you can. I am going to give you ear drops to also use for a week to maybe help with that sound in your ear, maybe improve the condition of your tympanic membrane. It just looks a little dry and pale to me. And let me know if your stomach improves with this ointment that I applied. I'm going to send you home with some of that as well.
Sounds great.
And if it doesn't get better, we can go ahead and do some imaging, do an MRI. Absolutely. So, do you have any questions for me?
No, thank you so much, Dr. Katie.
Yes, it was a pleasure doing this exam on you, and I hope to see you again in a year. And just keep up the good work with having a healthy lifestyle, and I'll see you again soon.
Great, thank you.
All right.